Tumor suppressor genes block the survival and the proliferation of cells. And in order to manifest the disease, the two alleles of a tumor suppressor gene must be lost. This is what we call the two-hit hypothesis. Let's start with the easy ones. Deleted in colon cancer is associated with colon cancer. Deleted in pancreatic cancer is associated with pancreatic cancer. Another name for it is SMAD4. Wilms tumor 1 is associated with Wilms tumor. MEN1, which makes menin, is associated with MEN1 syndrome. Let's move to the neurocutaneous. We have tuberous sclerosis, which has many hamartomas. So tuberous sclerosis 1, which makes hamartin, since it is associated with hamartomas. Tuberous sclerosis 2 makes tuberin in tuberous sclerosis. Whereas in neurofibromatosis, in type 1, it makes neurofibromin, and type 2 makes schwannomin, since it is associated with schwannomas. Another name for schwannomin is Merlin. Let's move to P53 and retinoblastoma. Retinoblastoma has a space that would either take a phosphate group or the elongation factor 2. Elongation factor 2 is important for the progression of the cell cycle. And in order to keep the retinoblastoma phosphorylated, this is achieved via the cyclin-dependent kinases, which will keep the retinoblastoma phosphorylated. So if we want to stop the cell cycle, we should inhibit the cyclin-dependent kinases. This is achieved via the activation of the P53, which will activate P21, which will inhibit the cyclin-dependent kinases, so there will be less phosphorylation of the retinoblastoma, and it will take the elongation factor 2 and stop the cell cycle. If there is a mutation in P53, this will result in Li-Fraumeni syndrome or Sabella syndrome, which is sarcomas, breast cancer, leukemias, and adrenal tumors. Whereas a mutation in retinoblastoma will result in retinoblastoma and osteosarcoma. Let's move to cyclin-dependent kinase inhibitor 2A. This will form P16, which will inhibit the cyclin-dependent kinases, which are important for the progression from G1 to the S phase. A mutation in cyclin-dependent kinase inhibitor 2A is associated with melanomas and breast cancer. Let's move to the gynecological tumors. We have BRCA1 and 2 genes, which are associated with breast and ovarian cancers, since they are important in the DNA repair. Let's move to B10. It is associated with breast and endometrial cancers. B10 will inhibit the phosphoinositide 3 kinase AKT pathway. So phosphoinositide 3 kinase is important for the phosphorylation, which will eventually lead to the phosphorylation of the AKT, which promotes the survival of the cells. B10 will block the phosphorylation, so it will inhibit the phosphoinositide 3 kinase AKT pathway. Let's move to adenomatous polyposis coli, or ABC gene. It is associated with colorectal cancer in familial adenomatous polyposis. It will inhibit the 1-beta-catenin pathway. So the 1 will bind and it will activate the beta-catenin, which will go to the nucleus and initiate the transcription of important factors for the proliferation of the cells. ABC will bind to beta-catenin and degrade it to stop the proliferation. Lastly, we have von Hippel-Lindau, which inhibits hypoxia-inducible factor 1A. Since the name, it will form very vascular tumors, since they are induced by hypoxia. So we have hemangioblastomas, pheochromocytomas, and renal cell carcinomas.